My name's Andrea Montiel, and I'm a midwife. I've been a nurse midwife for over a decade, probably going on 11 years, but I was a labor and delivery nurse before that for about 5 years, so I've been in the field for 15 years now. Something that I really wanted to do for women is make them feel safe in such a very vulnerable and important time in their life, and so this was a really good avenue for me to do that and still maintain a family home. I provide care here at Scripps Memorial Hospital in La Jolla. I've worked in a number of different hospitals throughout my career, and I have to say that Scripps is one of the best places that I have ever worked. The caliber of nurses that we have is incredible. The caliber of providers that we have is incredible. I think we're doing a really great job in trying to listen to our patients and really make their experience what they want it to be. A nurse midwife we're notorious for spending tons of time with our patients. We do a lot of bedside time, and so we sit by our patient. We really encourage them to figure out what they want their process to be, and we really try and be an advocate for our patients to create that environment for them. But we are experts in the birthing process. This is what we focus on 100% of the time. I think the beauty of Scripps is that we work together really well as a team. And so when we have women that come in that are completely healthy, they're really low risk, that's our specialty, and that's what we do day in and day out. And so we really try and be the least interventional as possible, and we really try and promote a vaginal delivery if we can get that, but obviously making sure that our baby and our patient are safe. There is definitely an element of having the physician in-house, which is to me very comforting, and I think it should be very comforting for our patients. If there's an emergency, our doctors are by our side within 30 seconds. So essentially they have the best of both worlds. The most satisfying, rewarding part of my job is that I get to be a part of this incredible event in these families' lives, and it is never the same. Every birth is very different, and every birth is filled with just something that you can't find in any other aspect of your life. And so I feel very honored and I feel very proud that I get to be a part of this for patients. And I hope that I can create an environment for my patients that is very safe and very comforting, and just full of love. And I think patients and families, because essentially it's a family event, and I don't think they'll ever forget it. So if I can create something that's super special for them, it's really fulfilling.